Hi, this is your Houston chiropractor, Dr. Gregory Johnson. Today we're going to be going over an established patient visit, a comprehensive three-dimensional adjustment of a patient so that you can see how quickly we can get these things done once you've become a patient, once we've accepted you as a patient. Okay, this is Brian, so he's been coming in here for about a year now. He's coming in and getting what's called maintenance care, supportive care. So he knows a lot of the routine, but we're still going to show you some of the issues that he has. So first thing we're doing is we're going to check his posture three-dimensionally on the X, Y, and Z axes. So let's have you close your eyes, Brian. Flex your head forward all the way. Now when he does that, I can tell that he's got pulling back here, now backward all the way. And I also can see it kinks up right there. Take a deep breath in, let it all the way out. Now, as you can see, his head and neck are translated to the right on the x-axis. His head is also way forward on the z-axis. His head is also down just a little bit here on the x-axis. He's translated to the right, which makes his left shoulder high right here. And then when we look at him from the side view, we can see that his hands are out in front of his pelvis here, and you see how his shoulders are rounding a little bit right here. Now, when we look at his pelvis in the mirror, which I have him looking in the mirror, and his pelvis is translated to the right of center as well. So, very first thing I'm going to do, go ahead and open your eyes, Brian. We're going to have the patient, Brian, come over and lay on your table on the back. And we're going to decompress his spine right now on the y-axis. This is a very unique adjustment. If you've watched my channel, you've seen this adjustment, but not on Brian and not like this. So we're going to show you exactly how to do that. We have these hard rubber pins that we pin the pelvis in and stabilize that so that I can get a good pull or decompression on his spine from his occiput all the way down to his sacrum. So we lift the legs up, the table does, automatically for us, to where they're parallel with the floor. That changes the entire angle of his pelvis and relaxes the paraspinal musculature from his lumbar spine all the way up to his occiput or his skull. Now we're going to pin this pelvic bone in on the left side here, and then we're going to pin it in tightly on the right side, same way. Now we're going to come up here and want to make sure the patient keeps their mouth closed and does not bite their tongue. So keep your teeth closed, take a deep breath in through your nose, let it all the way out, and just relax this for me. Perfect, good job. It's that quick. It's a high velocity, low amplitude thrust directly in the y-axis. And we got movement all the way from his skull down to the low back. Felt that, didn't you, Brian?
Oh, it felt good.
Yeah. Now, I always check the patient's reflexes afterwards because it's great. It shows them they're not injured, and it also shows an increase in the patient's reflexes, usually before and after. Next thing I'm going to do is let him legs down and relax. Now, he knows how to get off the table properly, so we're going to move him over to the BioPhysics table next and adjust him in the X, Y, and Z axes. So let's turn sideways. Push yourself up. This is the correct way to get up, by the way. Now, let's have you over here, Brian, and we're going to have you lay right on your tummy for me with your face straight down in this little piece of paper. And we've got a place here for the patient to rest their hands. I'm going to let his head down just a little bit so we can stretch that spine out through here. Very first thing I'm going to do is check his leg length, and his right leg is a ½ inch short in this position. Now when I bring it up, you'll notice that it gets even, and watch how his pelvis raises up off the table and shifts to the right. That's a positive Knockless test. He also has a positive Deerfield test because the right leg got even. His right leg's not anatomically short, it's functionally short because his pelvis is out. So we're going to adjust that right sacroiliac joint in the X, Y, and Z axes on the right. His sacrum straight down in the y-axis and the z-axis. The left part of his sacrum straight down in the z and y-axes. And now I'm coming over and adjusting his left sacroiliac joint in the X, Y, and Z axes. Now, here he's got L5, which has gone backwards, retrolestes, pinching the nerve right down his low back. So, you'll notice the angle of my arm changing as I move up his spine. Now we're on L3. Now we are on L2. And you can see that the line of drive changes all the way up through the lumbar spine and through the curve. Now we're into his thoracic spine, and we're going to get some just nice, easy manipulation into his thoracic spine, moving his facet joints and allowing the nerve fibers to fire off and recalculate their position in the juxtaposition of one vertebra to another. I'm going to do one more adjustment on his sacrum right there. And we're going to come up to his cervical spine. Now he's got an atlas out right here on the right. And he also has C5 and C6 here on the right. But he has a lot of problems right up here in his upper back and shoulders because he reaches forward all the time. So I'm going to do a thumb move right here on this. Just let this breathe and relax. Perfect. Now we got movement all the way from T2 all the way up his cervical spine on that one. On this one. Perfect. Good job. That moved great. Now let's go ahead and have you sit up and face towards the desk. There we go. Perfect way to sit up, by the way. Now, he has shoulder problems as well, so I'm going to adjust both of his shoulders. Oh, see, we got some crepitus going on there. That's the grinding and popping noises that you hear. So I'm going to realign his glenohumeral joint right there on the right. Now the left one, there's some restriction there as well. Do you feel that right there, Brian?
Yeah.
Okay, look straight ahead for me. Posture and biomechanics and alignment are of ultimate importance in any adjustment, whether that's in the spine and or the extremities. Now we just adjusted his carpal bones, which helps carpal tunnel syndrome, numbness, tingling in the arms and hands. So he had pinched nerve in his neck all the way down. He had pinched nerve in his wrist. That's called double crush syndrome. So we're taking care of all that in one visit. Oh yeah, did you hear that? Probably heard that one on the video. And that one too. Perfect. Good job. And if you notice, we adjust every single joint from head to toe. And now we're going to come back over in front of the mirror. And we're going to do our last phase of the adjustment, in which I used an instrument to adjust his atlas on the x-axis. And that instrument is a very high velocity, low amplitude adjustment on the x-axis, but I put the patient in a mirror image. So let's close your eyes again. Flex forward all the way, backward all the way. See, he already has a better range of motion. Now, he's still got some forward head translation, still got some right translation. So here's his home exercises as well as his mirror image adjustment. So I'm going to lift both shoulders up, hold them back. There. Now I'm going to have his head come straight back in the Z-axis. We're going to translate him in the X-axis. And now I want you to shift your pelvis straight that way today. Have your head all the way back. Perfect. We adjust the atlas bilaterally, his occiput bilaterally, and the pelvis, sacrum, and sacroiliac joints. Now we're going to have the patient do his posture again. Flex forward all the way. Now look how much straighter that went and how much more range of motion he has. All the way back. Perfect. Take a deep breath in and relax. That's very good. His hands are look how far they came back. We still got one final move that we're going to do, which will finish this particular treatment and unwind his spine. Excellent. Okay, now we're going to do that very same thing one more time. All the way down, all the way back. Now, was that much smoother that time, Brian?
Yes, I feel good.
Yeah, great. Now, look where his arms are. Much better. See his hands right down the middle. His pelvis is right down the middle. Shoulders are more square. Head straighter. And we got his head to come back in the Z-axis. This is an established patient visit from your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.